Hi, welcome to MMC's Occupational Safety and Health OSH orientation. I'm your speaker for today's topic. I'm Engineer Jeric De Hoya from the Clinical Safety and Risk Management Department under the Quality Management Division. Okay, so to start, we have here in MMC the Culture of Safety, Quality and Compliance Program, also known as the CSQC program. In here, we have the vision, mission, and values of MMC, our quality principles, because we don't want to just do it here in Makati Med, but we want to do it with quality. And we also have the accreditation standards and regulatory authority requirements, which we also regularly comply. With this, all in all, we are able to provide high quality care not only to our patients, families, visitors, and of course, to all workers here in MMC. So let me introduce you to RA 11058, or also known as the Act of Strengthening Compliance with Occupational Safety and Health Standards and Providing Penalties for Violations thereof. So it was signed into law last August 17, 2018. Its effectivity started last September 6, 2018. The implementing rules and regulations, or the IRR, was released last December 6, 2018 as the Department of Labor and Employment Order number 198-18. The highlight of this law is that failure to follow the OSH standards will result to administrative fines computed on a per-day basis until full compliance. Okay, so knowing that this law exists, how can we know which and what standards to follow? With this in mind, we can refer to the Occupational Safety and Health Standards, also known as the Yellow Book. This book contains the administrative requirements, general safety and health rules, technical safety regulations, and other measures to eliminate or reduce OSH hazards in the workplace. It also aims to protect every working man against the dangers of injury, sickness, or death through safe and healthful working conditions. But how do we protect our workers from occupational hazards? In here, MMC fosters an environment of care, safety, and continuous improvement through a risk management framework by identification of hazards and risks, then application of necessary controls. So for the hazard, we have the health hazard. This may result to occupational or work-related diseases. And we also have the safety hazard that is associated with instantaneous events that have adverse effects on the work process. Under health hazard, we have chemical hazard, example of which are fumes and gases. We have biological hazard. Examples are bacteria and fungi. We also have physical hazard. Samples are noise and vibration. And lastly, we have ergonomic factors, which include manual handling and repetitive movements. Under the safety hazard, however, we have the unsafe act and unsafe conditions. We also have the occupational hazard, the workplace element which may affect the health of the worker. It is a potential element. It may be an object or condition that can cause harm in the workplace. Next, we have the risk. Risk is the combination of the likelihood of an occurrence of a hazardous event or exposure and the severity of injury or ill health it may cause, while exposure, on the other hand, is the contact with the hazard. Remember that risk only occurs if there is a hazard and exposure. So next is the risk assessment. Risk assessment involves the assessment of the workplace to identify things, situations, processes that may cause harm. Analysis is conducted to evaluate how likely and severe the risk is. For MMC, we have the following risk assessment, examples of which are environmental rounds, hazard identification, risk assessment and control, or also known as the HIRAC. Next is the hazardous materials inventory. We have the work environment measurement, or WEM. We have the failure mode and effect analysis, or FMEA. We have the medical device risk assessment, the hazard vulnerability analysis, or HVA, and the emergency drills. So for the risk management, it is to identify interim control measures and prioritize the hazards for control. It may be done through the management of incidents, handling of facility-related reports, conducting safety orientation before construction, renovation, and maintenance, compliance to regulatory and international organization standards requirements by the FMET group. The Occupational Safety and Health Committee oversees the implementation of the MMC OSH program. It aims to provide a safe and healthy work environment. More details about the OSH program can be seen in WAM under the Staff Qualification and Education or SQE. In here, we also have the organizational chart for the OSH committee. On top, we have the ex officio, the president and CEO of Makati Med, followed by the chairperson, which is the division head for the Human Resource Management and Development, followed by the OSH Executive Committee. Members are the division head of Human Resource Management and Development, division head of Quality Management, department manager of Infection Prevention and Control, department manager of Clinical Safety and Risk Management, and the Occupational Safety and Health Officers. Under the OSH Executive Committee, we have the following subcommittee and its members. We have the Employee Wellness Subcommittee, the Labor Management Subcommittee, the Technical Subcommittee, and the Safety Officers Link. But what does the OSH program contain? To give you an idea, here's the OSH program outline. We have there the Makati Medical Center OSH overview, objectives, and employee demographics. We also have the national laws and international accreditation standard compliance, the Makati Medical Center Occupational Safety and Health Committee, the Occupational Health Services, the Workplace Hazard Identification and Control, the Accident Investigation and Reporting. We also have the OSH activities and its performance measure, the regulatory reports that we needed to submit, the health promotion, training, and education, and of course, other OSH-related programs. For the OSH report requirements, we have the following. We have the Work Accident Illness Report or WIRE. We have the Annual Exposure Data Report. We have the Report of Safety Organization or RSO. We also submit the minutes of the meetings of Health and Safety Committee meetings, the Annual Medical Report or AMR. So as mentioned a while ago, here are the OSH-related programs and policies. We have the Drug-Free Workplace Program, the HIV and AIDS Workplace Policy and Program, the Hepatitis B Prevention in the Workplace. We also implement anti-sexual harassment policy and procedures, smoke-free workplace, TB in the workplace, breastfeeding policy, alcohol-free workplace program. We also have safe patient handling and second victim. Okay, so that covers all. Thank you for listening. Thank you.